A desperate man beating a woman with a pipe in a robbery gone wrong. A boyfriend shooting his girlfriend over burnt rice. A troubled man striking tourists with his car, then jumping out and stabbing them at random. An estranged husband shooting his wife to death. These are just some of the recent violent crimes facing the Guam community in recent months. A stark reminder that personal struggles on any scale can lead to violence. But how big of a role does addressing mental health play in preventing such crimes, and how can the island community address the stigma that seems to be embedded in our culture? Psychiatric social worker supervisor Nadine Cepeda talks about the need to bring awareness to mental health on Guam.
It actually is very, very needed and very important and critical in our community. Oftentimes we're considered at the back burner, but it's just like I tell my consumers that I work with and clients is that it's like diabetes. When you have diabetes and you don't feel well, you have headaches, your body's responding. The same thing with the mental illness. The same thing, you need to come and be assessed. And then those are the symptoms we look at: sleeping, eating habits, the energy level. Those are all symptoms that can lead to something that may impair your life or may not.
Cepeda is among the team of mental health professionals working diligently to overcome the negative perceptions about seeking counseling on the island. With the recent tragedy in Tumon last week, Cepeda says there has been an increase in counseling services for a wide range of concerns. But whether it's a tragedy of that magnitude or a simple talk, or even for those unsure what to do, Cepeda says it's important people know that there is help out there.
We have some people with some social phobias and have a difficult time interacting with other people in the community, or can be even feeling depressed, having some relational problems or financial problems. And it could be it's very severe, where they're hearing voices and not understanding, and it's something new. If you're not sure or in doubt, call us. We have a crisis hotline, 647-8833.
Last week, the island saw perhaps one of the biggest tragedies in recent years with a Tumon car and knife rampage that police say was committed by Chad DeSoto. Those closest to him say DeSoto was troubled over his parents' divorce and his girlfriend leaving him, which may be a factor in his state of mind. The tragedy sent shockwaves throughout the region and in Japan, as most of the victims were Japanese tourists. And while DeSoto's motive has not been revealed, what is clear, at least one senator says, is the island's need to strengthen its efforts in addressing mental health as early as birth.
I think as far as mental health goes, I think we need to really invest resources beginning at birth. I think our whole early childhood aspect needs to be invigorated. What just happened in Tumon, for me, is a mental health issue. I've gotten bits of information, and for me, Chad and his family, we need to do better at seeing troubled minds, and we need to do better at saying, this is who you call, this is where you go, and you have to do it.
Meanwhile, Cepeda says anyone can be afflicted with mental health problems, and it can range from mild to severe. But what's important, she says, is that we recognize the signs and seek help before it's too late.
But again, the importance of coming in, getting screened and assessed, is really doing preventive work. Or just a little stressor and feel like I need somebody to talk to, we're here. And those things can be managed before it even becomes a little more complicated. Treatment works. We've seen it. Recovery works. And so it's just the people in the community to come out and actually say, I need help, and recognize.